My name is Tom. I'm 38.
Hello YouTube, this is Dr. Paul from Amara Aesthetics. Today we're talking about Botox and fillers treatment for men. This is Thomas before the treatment. Thomas just wanted a bit of a rejuvenation. He didn't want crazy high cheeks or anything like that. He just wanted to take a few years off. I'm showing you what we're aiming to do here and where we're planning to add the filler to the cheeks. Just before that you can see Tom's frown lines and smile lines and what we're trying to do to get rid of those guys. This is the Botox treatment, which takes about 1 minute, maybe 90 seconds to do. We do usually 3 injections on each side of the eye, which is enough to weaken the muscles at the side of the eyes and allow for softening of those lines without making it look unnatural. This is the same injection from the other side. You can see I'm pressing after I do the injection just to make sure that it doesn't bleed too much. There's a small little bit for some people I do underneath the eye to try and get better results. This is across the forehead. Tom was looking to get rid of these horizontal lines in the forehead, the worry lines. We did 4 or 5 injections on each side. The needle is really small, as you can see. It looks and feels like a mosquito bite. The 2 sides, it's important to go quite high with men. With women you don't need to go so high, but with men, if you don't treat the very top of the muscle, sometimes men get a little bulge up in this area just where we're injecting right now, and that is how we treat the forehead. The second area on the forehead is in between the eyebrows, so injecting in 5 points in between the eyebrows weakens the muscle that causes you to have a angry frown, so that gives a more approachable, softened kind of look in between the eyebrows. So that's 5 injections, and as you can see that's about 10 seconds. Now this is a speeded up video of how we did the filler on the cheeks. You can see as each little bit of filler goes in, you can see where I've made the white marks, it's a little bit flat, so we just inject a small bit of hyaluronic acid based filler into those areas, which helps to fill out those spaces and make the cheek look less hollow in those areas. Hyaluronic acid sounds very scary, and it sounds like, you know, what are you doing injecting acid into people's faces, but it's actually a chemical that's found naturally in your skin. You can see Siobhan is pressing on where I've injected. The bit of pressure that she's applying is enough to make sure that there's no crazy bruising, and that keeps things, keeps anyone from finding out that you've had a treatment done, and stops you having any very bad bruises over the next few days. Typically on each side I do 1, 2, 3, maybe 5 to 8 injections. Each one of these injections in real time, from here to when I finish that injection there, takes about 5 seconds. It took about 2 seconds on the video there, but it's a 5-second injection. So that was, I think he had about 8 on each side. As you can see, Thomas is chatting away and he's, quite relaxed and comfortable while the treatment's being done. Again, Siobhan applies pressure to any points that keep on bleeding, just to make sure that there's no risk of bruising. Now the next step is where I use a device called a cannula. The cannula is where we make a small entry point with the bigger needle, then we replace the bigger needle with a blunt needle. That blunt needle or cannula allows me to move in around underneath the eye without any discomfort or pain, and without damaging any little blood vessels or nerves. So it's a much safer way of putting filler into areas that are in any way sensitive. And it allows me to cover a bigger area without having to put lots of needles in there. So where that cannula's gone, I can be 99% sure there won't be any bruises in that area. So it's another way to reduce the risk of bruising. It's difficult to appreciate from this angle, but Thomas's cheek is slightly fuller. The amount of filler we've done on that, well, actually, yeah, you can see when you compare right side versus left side, that the cheek is a little bit rounder. It's not as hollow in those few points, but not overly so, not unnaturally so. So obviously we've to do the same on both sides, so we'll repeat the process on the left. Again, Siobhan applies pressure to make sure that it's not bleeding too much and to reduce the risk of any bruises. So when it comes to men getting Botox and fillers treatment, a question a lot of people ask is, you know, are many men getting treatment done? You know, which men get Botox and fillers done, and how many of them compared to women getting treatment done? I would say, in my experience, it is about 10 to 1. So for every, 9 to 1. So for every 9 women getting Botox, there's 1 guy getting Botox. So that has changed quite a bit, because before there were very few men getting treatments done, but now it's becoming more popular. This is after we've added filler to the left side.
No, but I guess I had any Botox, anything like that. At the end of the day, they said it just looks brilliant because it looks very natural and it's not really visible. It's just the fact you look relaxed. That's pretty much whole result. You will see the difference literally straight away. It was quick. It was really. I felt fine after that. Afterwards, and I didn't have any bruise, anything like that. I literally went for dinner the same evening after the procedure straight away. I look more relaxed, look very fresh, and it looks like literally like I had a good sleep.